Title screen: Disability Rights North Carolina. Advocates for Medically Fragile Kids NC. Champion for equality and justice. Corey Dunn, Disability Rights NC Director of Public Policy.
In 2016, we started receiving a number of phone calls and emails from parents whose children were enrolled in CAP-C.
Community Alternatives Program for Children, CAP-C, is a Medicaid-funded program for children with significant medical needs.
They were the folks who eventually went on to organize Advocates for Medically Fragile Children.
Jenny Hobbs, co-founder of Advocates for Medically Fragile Kids NC.
I have 3 children that are in the CAP-C program.
A photo of Jenny's family.
And had been following the proposed policy changes since they first came out back in 2015. During public comment period, I would submit my comments in hopes that, someone was reading them, paying attention, that things would be better when they came back around the next time. And instead of seeing positive changes, I kept seeing more and more negative changes to the program, I felt like. And the next day wrote a letter.
Jenny's letter with the headline, How to Help Advocate for Families of Medically Fragile Children in NC Who Risk Losing Services with the Proposed Waiver.
To send to friends and family to say, I need your help. Like, we can't let this happen. It's not right. I shared it on Facebook. Lots of friends saw it who are in a similar situation. You also have kids in the program. They were upset. The letter kind of got shared.
The Facebook page for Advocates for Medically Fragile Kids NC with more than 2,600 members.
Momentum really grew and really fast. Looking back and then looking where we are, I'm like, wow, we really did make a difference. It's really exciting.
Dave Richard, Deputy Secretary of Medical Assistance at the NC Department of Health and Human Services.
We began trying to find people that would be interested in serving on a stakeholder work group with us, and we clearly wanted to have people that were benefiting from the CAP-C services.
A photo of the co-founders, Elaine Nell, Natalie Weaver, and Jenny Hobbs.
And that's when we found this group of families that were active, that apparently had been the organizers of the Facebook campaign and all the other social media activities that engaged people at a level that we've never seen before.
Corey Dunn.
The women who contacted us were tireless. They were so focused and so clear about what they needed that it was impossible to ignore them. They were incredibly good at articulating the impact of DHHS decisions on the lives of their children and their families. And that was really compelling.
They were outrageously well informed, I would say this, often knew more about what the subject was than I think we had most of our advocates would ever know. Sometimes things that we weren't aware of, they were aware of because it's a massive policy. But they were absolutely committed to working with us to find solutions.
Video from WRL TV of a public meeting on the CAP-C waiver.
The preparedness, the absolute commitment to work with us to do those things, and the ability to touch so many folks that, frankly, as a state agency, we find difficult to do. What we found is that incredibly committed, passionate folks that want the system to work better for everybody, not just their children.
I'd like to give you a glimpse into our lives with a medically fragile child.
A Facebook video of Natalie Weaver with her daughter Sophia receiving medical care.
Sophia has to receive her medication 20 times a day.
They have really become experts, not just in their own experience. They were already experts in their own experience.
A news article with a picture of Elaine Nell's infant daughter Lydia after surgery to remove 80% of her intestines.
But they really have become experts in what federal law requires, what sort of constraints the North Carolina Department of Health and Human Services is working inside of in order to create services. And that's been really powerful. It's rare to get the combination of personal experience that they have and the policy expertise that they have worked to develop very quickly.
The effect was clear. We pulled our proposal to combine the waiver.
An email from Dave Richard, which reads, as a result of comments from you and many others, we've decided to suspend work on approval of waiver changes while we work with stakeholders to find the best solution going forward.
We spent the summer and most of the fall working on a new plan of moving forward with this stakeholder group. And then we were able to propose to CMS in late fall the changes in the waiver, which they approved in February.
A photo of the co-founders with Dave Richard and North Carolina Secretary of Health and Human Services Mandy Cohen.
There will be more children served by the program, in part because of their advocacy. Not only have they been an enormously important voice in discussions with DMA and with the state legislature.
A photo of Jenny Hobbs and her daughter Madison outside Senator Richard Burr's office.
They've taken their experience and expertise to DC now.
A photo of Natalie Weaver with Senator Tom Tillis.
It's absolutely essential that policymakers in Congress hear stories like these families have.
Natalie Weaver at a news conference with U.S. senators in Washington, D.C.
My husband has a great job, works full-time, and our family has private insurance. Despite that, it doesn't cover our daughter's in-home nursing, life-saving medical equipment, or portions of her life-saving medications. Thankfully, my daughter receives secondary insurance through Medicaid's home and community-based services. This amazing program helps cover the many costs that private insurance won't and allows us to have a hospital-style setup in Sophia's bedroom so that she can remain safe and cared for in our home.
One of the moms, again, was in D.C. and advocating strongly for what she believed in terms about the Affordable Care Act and the changes that happened there. I think that's what this country's about, right?
Photos of the co-founders with state senators Erica Smith Ingram and Michael Lee.
When families or when people are affected by policy interact with government and government changes because of it.
The co-founders with staff from Disability Rights NC and Moms Rising NC.
That should give people hope that that the system actually does work. Not always perfectly, but it does work. So it's pretty exciting.